It's the place you go if you are sick or injured, but it may end up causing you harm and even costing your life. It is estimated that every year, as many as 2 million patients develop hospital-acquired infections, and that anywhere from 98,000 to as many as 195,000 patients die from preventable medical errors in our nation's hospitals. That makes preventable medical errors one of the leading causes of death in the United States. Many say even though these mistakes are avoidable, our medical system isn't designed to prevent them.
The more procedures that are performed, the longer the stay in the hospital, the more tests that are ordered, the more fees that are generated, the more doctors are paid, and the more hospitals are paid. And consequently, the emphasis historically has been on not preventing a condition or preventing errors, but it's been on treatment. And that's where the emphasis has been misplaced, in my opinion. And because that's been the emphasis, there has not been the incentive on the medical community and hospitals, with rare exceptions, to focus on how do we prevent medical errors, how do we prevent harms and losses from occurring to patients.
Preventable medical errors include misdiagnoses, administering the wrong medications or the wrong dose of the correct medication, or surgeons performing the wrong procedure or using improper technique in the operating room. But often, the most common preventable condition is infection.
It's estimated that as many as 2 million people each year who are hospitalized develop an infection as a result of their hospitalization. And of that number, as many as 500,000 people develop an infection following a surgical procedure. It's estimated that as much as $50,000 to $100,000 in additional medical expense is incurred as a result of this problem. It's a very common problem.
Nurse Terry Patterson is a certified rehabilitation nurse who specializes in developing life care plans for patients who have suffered permanent harm and losses from preventable medical errors. She says that even if a patient survives a medical mistake, these mishaps can lead to a lifetime of emotional and physical distress, as well as mounting financial costs.
When someone experiences a catastrophic event, it changes everything. It changes everything that they do in their life, in their job, with their family, in the community, at school, at work. And they really need to be able to take a look at the entire disability and how it impacts every aspect of that. As a rehabilitation nurse, what we do is design what's called a life care plan. And the life care plan will really outline all the future care needs based upon the disability, such as an amputation or a spinal cord injury. Some of the expenses that are unique to someone who has a disability would be, first of all, their living arrangements, their home. So they need adaptive equipment, they need wheelchairs, they may need a scooter. They also need people sometimes in terms of nurses and aides to physically help them and assist them with bathing and dressing and things like that around the home. And they need to have an environment that's safe for them. So we often recommend a one-floor living arrangement or a situation where we can put ramps into the home, widen doorways, reinforced floors, things like that that really promote their ability to be as independent as possible within their own home.
Many say financial settlements don't just help individual victims, they help all patients receive better care. When healthcare providers are held accountable for medical errors, they are more likely to change policies to prevent further mistakes.
In the 1970s, about 8% of all medical malpractice cases involved anesthesiologists. As a result of those lawsuits, in 1983, the American Society of Anesthesiologists commissioned a study called the Closed Case Study, in which they took all these lawsuits and they had researchers analyze them to make a determination as to whether or not there were improvements in anesthesia practices that could be implemented that would reduce the incidence of death and catastrophic injury. And in fact, as a result of the study and the recommendations made and their adoption by the American Society of Anesthesiologists, the incidence of death in the operating room went from 1 in 10,000 to 1 in 200,000.
The team at Young, Ricciuti, Caldwell, and Heller know how devastating medical errors can be for victims and their families. Between lost paychecks and mounting medical expenses, malpractice victims need help, and the healthcare providers responsible need to be held accountable.
At Young Ricciuti, we're very proud to be part of really a tradition of careful trial lawyers who represent families and represent individuals and people in really these David and Goliath situations. And we're always in there on behalf of David against often some very large and powerful institutions. And what we can do is make sure that everyone is as focused as they should be on patient safety and on making the kinds of choices that advance patient safety.
But these effective litigators do more than just help past victims. By highlighting flawed procedures and policies, they act as catalysts for change, protecting new patients from suffering from the same errors.
We have helped make reducing medical errors a priority for hospitals and healthcare providers generally by inserting or putting into the system an economic incentive that doesn't exist otherwise for them to pay attention to preventable medical errors. So we created an incentive for hospitals to address issues that come up in maybe one case, but also may come up in other cases. Address issues like policies and procedures they follow, supervision and training of doctors and other healthcare providers.
While healthcare organizations continue to make changes to reduce medical errors, mistakes can happen. The offices of Young, Ricciuti, Caldwell, and Heller will be there to protect the rights of victims in need.
I feel very fortunate to be able to practice with a bunch of lawyers who really share that vision, and it's this whole concept of us making our own choice to stand next to families, to stand next to the Davids of the world. That's what gets us out of bed in the morning.
The future of our practice, I think, will be very much like it has been in the past. The lawyers at Young, Ricciuti, Caldwell, and Heller have been handling cases, and primarily medical malpractice cases, some for over 25 or 30 years. We've been successful in that regard, and we will continue to follow the philosophies that we followed up to now by getting to know our clients and representing our clients as well as we can, and by learning the medical issues and being able to present the best possible case for our clients in the courtroom.
If you are a victim of a medical error, contact the attorneys at Young, Ricciuti, Caldwell, and Heller. For more information, visit yrchlaw.com.